Welcome to The Culture. We rest at the pulse of the community, providing all things news, music, fashion, events, and everything that we talk about in between. It's a lifestyle. We are The Culture. Hi, and welcome to another edition of The Culture. I'm your host, Jessica Garrett Modkins, and joining me today is none other than Dr. Todra Rhodes-Anderson, Chief Medical Officer at Memorial Hospital in Miramar. Hi, how are you today?
Hi, hello, Jessica. So glad to be here with you today.
Yes, I'm so glad that you're here. And today it's all about COVID-19 and Black people, just everything that we need to know. So let's start the show out really broad and talking globally, nationally. Where are we?
So Jessica, we're almost 14 months into this pandemic, and I'd love to say that, we're nearing the end, but unfortunately I can't. Globally now, as you may know, we're over 131 million cases and closing in on 3 million deaths. And here in the United States, nationally, we're still, although it's slowed down, we are still now in the last 7 to 10 days seeing an uptick nationally. So over 30 million cases in the United States with, unfortunately, over 500,000 deaths, which is just, you want to cry every time you think about it. But I can say, here in the state of Florida, overall, we had been seeing a nice sort of leveling out of the curve and a nice decline. So that was, something that we were looking at as a positive. But we still here in South Florida need to be extra careful because while the rest of the state seemed to have slowed down, certainly with the recent spring break, et cetera, we saw also an uptick of cases here in South Florida in Broward County, Miami-Dade County, and Palm Beach County. So we want to make sure that we get the message out that while we are currently, have some more hope that we, particularly in communities of color, are still disproportionately affected. And certainly here in South Florida, where we have huge communities of color, we are still, sort of in the high risk zone.
Yeah, and why is that? What is the underlining factor as to those disparities for African Americans?
Yeah, so Jessica, in African Americans and in other communities of color, including our Hispanic brothers and sisters, there are a myriad of factors. There's not just one. Certainly we've known about healthcare disparities. Access to care continues to be an issue. And when we talk about access, Jessica, it's not just can I get an appointment? It's can I get an appointment that makes sense for me and my work life and my children? Can I get it after hours? Even when it comes to telemedicine and telehealth space, we now know that just because folks have an iPhone or a smartphone isn't the same as being able to then communicate well through that with your provider, right? Because I need to have the minutes that are available on my phone. So if I'm going to do a telemedicine visit, I have to have enough minutes. Not everybody has unlimited minutes. I have to be able to have connectivity. Am I in an area that has that? So access to care continues to be huge in communities of color and access that makes sense for the person, not necessarily for the provider. There's still miscommunication in communities of color, legends, things that we talk about that make us mistrustful of the healthcare system, which is unfortunate, but we need to make sure that we are aware of those and that if we have people who are hesitant, that we can talk about those and really ask people, if they're afraid in terms of what they've heard about the Tuskegee experiment, that we can explain to them that the Tuskegee experiment, while it was unfortunate and certainly unethical, we weren't giving people, or the healthcare providers weren't giving people syphilis. They were withholding medication, which is a little bit different. We talk about treatments now in the COVID era. And I do think that it's important for us to also recognize that there are certain diseases that are more prevalent in us as people of color, particularly African Americans, that place us at higher risk. So things like chronic kidney disease, which is 4 times more higher in African Americans, which is on the one of the highest risk factors for COVID and severity of COVID. Sickle cell disease, which is also affects us disproportionately as people of color. Hypertension, diabetes, all those things that we hear about that we want to try to prevent, they do disproportionately affect us as people of color. And then they are on the list of the highest risk factors for COVID and severity of COVID. And then obesity, one of the things that we don't like to talk about a lot, but it is true that those persons who are more obese, which is disproportionately affecting people of color in a lot of our communities, is one of the highest risk factors, even for younger people. So we tend to think of, higher the age, that the more severe, and certainly there are, we have seen that, but across all age range, obesity tends to be a really serious risk factor for severity of disease for COVID, not just getting COVID, but that the severity of COVID and ultimately, unfortunately, dying from COVID. So those are a few, of the things that come top of mind. Housing is another one. So lending practices where traditionally, people of color have not been afforded the same rights when it comes to trying to get a mortgage or a loan for a property. And so the density of our housing also tends to play a role in our disproportionate, being affected disproportionately.
It's a lot. It's a myriad of factors, as you indicated. So the Biden administration this week was talking about this rollout of ensuring that there's equitable distribution of COVID vaccinations. What's the latest regarding the COVID vaccines?
Oh, Jessica, there's so much since we last talked, but I am really hopeful with regards to this current administration's determination, really, to try to level some of the playing field when it comes to COVID and vaccinations, and ensuring that communities of color and those who are in communities that have been really forgotten about or left behind have that access. So as it relates to vaccines, we do have the 2 emergency use authorization mRNA vaccines that we started with, which was Pfizer initially at the end of last year, and then also the Moderna vaccine, which require 2 shots or 2 doses scheduled apart. And then now we have the Johnson & Johnson or the Janssen vaccine, which is a single shot. And so when you look at certain communities, I was really pleased, even watching the news last night, in Miami-Dade County, in Miami-Dade North Campus, they're going to be rolling out Johnson & Johnson today. I mean, I was just like so tickled. So there are areas and communities which are going to have access to the vaccine, which I think is going to just be work wonders for the rest of us. And so I'm encouraging everyone to please check your websites for, Department of Health, for your county, but also for the state. And also the CDC has a great website that you can actually look and see where the vaccines are being distributed. I know in North Dade, at the North Dade Health Clinic, they have been wonderful partners with so many organizations that we're both a part of, really getting people of color to know that there is access, that it is available, and really allowing people to adjust their schedule so that they can come in and be vaccinated.
And are those vaccinations interchangeable? If you were to get Pfizer, could you then go back and get another?
Great question, Jessica. No, the vaccines are not interchangeable. So if you started with Pfizer, you must stay with Pfizer. And those vaccines are given 3 weeks apart, about 3 weeks apart. If it's Pfizer. And the Moderna, you start with Moderna, please continue and go back for your second dose of Moderna. Those are given about 4 weeks apart. Even if you're a little delayed for some reason, still stick with that same vaccine. We are still studying and researching the long-term effects of all of the vaccination programs. And so the research to date does not suggest that you can interchange them at all. If you have a concern, or your listeners, the audience has a concern, please ask them to contact their healthcare provider, the place where they received their initial vaccine. There should have been those set aside for those particular persons who received the first doses. And that's really critical because we know that you're not really considered fully vaccinated until about 2 weeks after your last dose. And we are now, unfortunately, seeing where some persons have, in between or after, before they're fully vaccinated, where they've sort of let down their guard, and those persons are at risk for contracting COVID-19. So it's really important. Great question. The good news about the Janssen vaccine is that it's only one dose. You still have that 2-week waiting period after you get that dose before you're considered fully vaccinated. And that's a really important point. So still wearing your mask, hand washing, doing all those things in the interim. But even after you're fully vaccinated, Jessica, still really important to practice those 3 W's, where you're wearing your mask, washing your hands and washing your surfaces, and really watching your distance to make sure that you're socially distanced, because not enough people have been vaccinated yet. And we do have a long way to go before we get to that herd immunity. I am pleased to say that in the United States, we've probably vaccinated about 165 million folks. That includes a little over about 105 million who've received the first dose, but that's only 32% of the population in the United States. And then regarding that second dose, we have about 58 million plus who have received their second dose, but that's only about just shy of 18% of the population. So even though we're making headway, we still have room to go. And so we want everybody to be really careful about that.
And let's go back to Janssen, because the Johnson & Johnson had this big to do, and I would like for you to provide some knowledge around the headlines that came out just here recently about the batches of doses. I believe it may have been up to 15 million doses were contaminated and destroyed. Yeah. What does that mean? And just provide some clarity to it, to people who are looking at this broadcast and would like to have the 1 dose option, but a little hesitant based off of the storyline.
Right. Well, the news is the news. And so they do make, the headlines. But what I will say, and certainly knowing folks who work in that arena, particularly with Johnson & Johnson, we do certain types of controls. It would be like if you came to the hospital and you needed to receive blood, right? We track that, and we have certain safety measures in place. So if something doesn't meet the test, then we discard that. We wouldn't give that to a patient. And so similarly, with these vaccines, as all medications like, Tylenol or Motrin or a bottle of water, right? There's security controls that there's a certain number that you need to test, make sure it's safe for the people who are going to take that. And so similar to that, the vaccinations, you have certain tests that are being done all the time. And so if there's something that is less than, what you've decided and what the research has shown that you need to give somebody, we pull those off the shelf, right? And similarly for those vaccines, it didn't meet the sniff test, so to speak. You have to pull those out because, you don't want to have any issues. You don't want people to get sick, even if it's a minor thing. You don't want there to be any discussion related to, is this the right thing to do or not? So we always in medicine err on the side of safety. We take, and at the United States especially, we take particular pride in making sure that we have met all of the criteria. There might be 50 criteria. You miss one, it might have to come off the shelf. But what I can say, and what I'm really thankful about, is that we have those types of inspections to make sure that we're providing the best products, the safest products. And so what I can say is that the vaccine that's out there is as safe as possible. There are people who are expecting all the time. There's also even, adverse event reporting through the VAERS system, regardless of which vaccine you get. And when I got the vaccine, I loved it. And when my mom got it, you get a little reminder on your phone. It's time to do your checker. They ask you a series of questions. So they're monitoring, they're gathering more data regarding those of us who have been vaccinated to ensure for those who come behind us that it's still safe. So what I would say to those who have seen that is that's a good thing, and I'm grateful to be in the United States where we have those types of controls. But what I can also say is that I know that the product that then is out there that does make it to those sites, that it is safe. And I also recommend that if people have questions, to really talk to their healthcare provider Talk to people who are knowledgeable, who are not looking just for a story, Jessica, but people who can really inform us. And most of those people, we want them to be culturally competent. And you and I speak about this all the time. Culturally competent is not about a race, a sex, an ethnic group or anything like that. It's understanding where if I'm the patient, or you, if you're the patient, where we are right now. How does this fit into my life, my lifestyle, my family, my health history, my mental history, my other behaviors? So having someone who understands who I am and where I am, and is this something that is right for me? Is this something that will help to protect me? Is this something that will help me to have the lifestyle and the life that I really deserve to have, at this point in time? So finding that culturally competent person that you can trust, I think, is critical. And if you feel like you're at some place that doesn't offer that, I always tell people, pick up your bag and go find someplace else to go.
Good point. Good recommendation. So what are some of the side effects from the vaccine?
So Jessica, the most common side effect is really, soreness at the site. And that can last for, up to a couple of hours to a couple of days. But the good news is if you work that area out, it actually goes away pretty quickly. And then the others would be a little bit of like chills, fever. Fatigue is huge. I will tell you that of those persons that I know who had side effects, that feeling like I can't get my head off the pillow was something that people have absolutely talked about. Fever, again, mild fever, usually lasting only a day or two, which is great. And we're really happy that although about 5 to 15% of persons do experience side effects, they do tend to be on the mild or minor side with those muscle aches, things that almost make you feel like you have a mild flu almost. But that's really the body's signal that it's working. And so I tell people all the time, that's not necessarily a bad thing. And while the current recommendation is not to take medications to pre-medicate yourself before the vaccine, you certainly can take Tylenol or Advil as long as you have no other contraindications to that afterwards to see if it makes you feel a little bit better. Getting rest, though, definitely helps. Like Mom used to always tell us, right?
Right. And you mentioned this earlier in our discussion. You're fully vaccinated. You've gotten both of your doses. If you did Moderna or you did Pfizer or you did your single shot, if you did Johnson & Johnson, and you passed that incubation period, which I believe there are two separate time periods for Johnson & Johnson, Pfizer, as well as Moderna, right? But yes, getting into the incubation period,
Mm-hmm.
you are fully vaccinated. But where my question was going was that even when you have been immunized, you still may be able to contract COVID.
Yes. So, one of the things that we want to make sure that everybody's aware of is that Pfizer is about 95% effective in terms of prevention. And then you're correct. There, after the second dose, after 3 weeks, you still have 2 more weeks to wait to fully immunize. Moderna is about 94% effective. And if you'll recall, Johnson & Johnson, worldwide, the data showed it was about 66% effective, Jessica, once you hit that immunization point. Here in the United States, the percentage was actually a little bit higher, in the low 70s. In terms of prevention, which is still a great number, especially when you consider efficacy of most other vaccination programs. The real good thing, though, about these vaccines is that then when secondarily, the goal is to prevent severe disease. So Janssen, for instance, is still 85% effective. So should you get COVID, it's 85% of the time you will not get severe COVID, meaning not needing to be intubated, not needing to be hospitalized or severely sick, which then increase your risk, unfortunately, of succumbing to the disease. So when we look at endpoints, that's an important distinction because you can still get COVID, but the severity of COVID would be less. And that's why we're still recommending at this time, because we're, again, The data, we're still collecting the data. Scientists are still analyzing the data, and we're still looking to see what are those long-term effects going to be of these vaccination programs in order to try to achieve what we consider herd immunity. So still important, and I can't say it enough, and I appreciate you carrying the message, Jessica. Physical distancing, making sure that people are not in your space if that's possible, and even in your workspace, right? So at the lunch counter, lunch rooms, making sure you have enough distance, because that's when we take our masks off to eat. We may be laughing, chatting. So can we put up a little barrier, some sort of plexiglass barrier that keeps us safe? Wearing our mask, but also wearing our mask properly, Jessica. I can't tell you how many times I see people walking around, and I have, started to venture out just a little bit, trying to get a bite to eat here or there, with other friends who are vaccinated. And if I'm in a restaurant, or outdoors at a restaurant, and I see, the servers with their masks not properly worn, I make mention to them, can you wear this properly? Because then, if they should have it, they could contaminate the surfaces or something else, and we could all still be at risk. So wearing it, not only wearing a mask, but wearing the mask properly over your nose, cover your mouth, under your chin, all the time is so important.
Yes, 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 yes. And even being asymptomatic. I've seen a number of friends who've been fully vaccinated and they just feel like it is just life has opened up again. And I'm going, you've
No,
got to continue to maintain the same type of precautions that you were prior to your vaccination. You being vaccinated doesn't give you full range to be all in my face.
I agree. I agree, Jessica. I'm the same way, and I think that's important for us to say so, because it's not about being rude, it's about being protective, right? And you and I both have elderly parents, moms. And so I'm always telling people it's not just about me, it's also about the people who are in my circle, in my space, in my bubble, so to speak. And, I even have children who have, medical issues. So we want to make sure that we're protecting ourselves, but we're also protecting our loved ones. We're protecting those in our bubble. And so you're correct that unfortunately, none of the vaccines thus far is 100% in terms of preventing us from getting COVID. It certainly minimizes it. And the more that we can get more people vaccinated and then get that herd immunity, then the likelihood of us being able to stamp this out is much higher, but we're certainly not there yet. I think we're on the right path, and access to the vaccine, particularly in our communities of color, is important. And then for us advocating for people to get the vaccine. So, one of the reasons outside of helping myself was really to be a role model for my community and for, the people I care about, but also my communities of color, particularly here in Miramar, where I am. We have, it's a very diverse community, and I want people to know, as a scientist, as a physician, I followed the science. I read everything. As a matter of fact, I was so excited just in the last few days. Some new information is coming about with regards to vaccination in pregnant women and lactating women. But I'm reading something every single day. I think that's important. But we want to be role models for those and have these kind of conversations and honest conversations to say, listen, it's not 100%, but right now, this is where we are. And for me as a person, as a personal decision, I felt like it was the right decision, and I wanted to share that with others.
Yes. Now, what about those people who may have already gone through COVID-19? They've had it, they are back, they are fine to go out. Would you recommend them also getting the vaccine?
Absolutely, Jessica, because if you've already had COVID-19, then you were high risk in some sense, whether it was because you're around people in your surroundings, perhaps where you worked, or some other risk factor that maybe you had. So the current recommendation is absolutely for those who've had COVID to consider vaccination. Again, this needs to be in tandem with speaking with your healthcare provider, but it definitely makes sense. There's usually a little bit of a waiting period, and that also varies depending on where a person is. So for those who may have loved ones, let's say in assisted living facilities or skilled nursing facilities, if they've had COVID, then that recommendation may be a little shorter. But for the average person, it's about 90 days. And Really, that's because it's unusual, although it could happen. It's unusual for someone who's had COVID to be reinfected within that period of time. Again, not 100%, but very unlikely. And so most people would suggest to wait that 90 days and then to get the vaccine. And that's critically important to make sure that you do follow through and definitely get it and definitely follow all the recommendations as it relates to getting vaccinated after having COVID.
Now, as we're wrapping, I really wanted, before you left, to talk about any other treatments that may be out there outside of the vaccine.
Right. So the best treatment is prevention. So trying not to get it. That's still the number one. But for those, making sure you're as healthy as possible, Jessica. So eating right, exercising, getting plenty of rest, again, watching your surroundings. Those are other things that folks can do. Certainly vitamins, multivitamins, vitamin C, vitamin D. And though the research hasn't shown it to be efficacious in terms of statistically significant, we still do recommend it because it does definitely still help you in terms of your general health. People are also recommending zinc. You just have to make sure you're not overtaking it. You really just take the recommended doses because there can be some damage to cells if you take too much of it. And then really for the treatment wise, remdesivir is an approved antiviral treatment. It is reserved for inpatient, so more moderate to severe, and that is based on certain risk factors. And then we do have antibody therapy. So if you're inpatient or a loved one is inpatient, they should ask the healthcare providers about convalescent plasma, which is basically we take the blood from those who've had COVID, take their antibodies and pool them together. So it is a transfusion. There are some side effects. Not everybody can get it, but if they meet the criteria, that's something to have in their pocket to ask about. And in outpatient settings, the antibody therapies are monoclonal antibodies. There are some sites here in South Florida that have been deemed appropriate. And I like for folks to know that. So if you go to an emergency department and unfortunately have been diagnosed with COVID and it's time sensitive, so make sure you ask, am I a candidate for monoclonal antibody therapy or just antibody therapy? Because it's probably one of the largest kept secrets, but it really has been shown to be effective. It is also emergency use authorized. And so we'd want to make sure that persons who are eligible can make sure that they get that. And the last point I want to say, Jessica, although it's not a treatment per se, self-care in this era of COVID, we've been going through this a long time. Many of us are fatigued. And when you're fatigued, you let your guard down. You're not as conscientious of your surroundings. So I just want to advocate for all of us that self-care is important, particularly in this pandemic. So we do need to take time, we're always on the go, but we need to take time to just, sit and rest, reflect, not worry about what's coming next, but just kind of sit in the moment, be thankful and grateful, connect virtually like you and I are doing now and that we do with, in so many settings with our friends and our family, meditate, pray, get some physical activity if you can, and especially outside time. Right now the weather's beautiful. Just smell the fresh air. All of those things that our parents long time ago taught us, like making us go outside. Right. There's really something to be said for the sun and getting that vitamin D naturally that really just lifts our spirits and it makes us healthier holistically. And so I can't stress enough that when we talk about treatment, taking care of ourselves and that self-care is so quite important.
Dr. Rhodes-Anderson, perfect way to end the show. Thank you so much for joining us. You always bring so much insight and just practical things that we should take into account as we move forward. You are a breath of fresh air and a word of advice to everyone listening. So thank you so much for joining us today.
Thank you, Jessica, for having me. Be safe and stay well.
Will do. And for all of you, please make sure to stop by again tonight at 6 p.m. where we'll be having another round of My 2 Cents with the crew. It'll be on all of our At The Culture platforms on YouTube and on Facebook. See you next time.
The Culture is produced and owned by Hip Rock Star Media and cannot be reproduced or broadcast without written consent by Jessica Garrett Modkins. All rights reserved 2020.